And this, I dare say, is the only TikTok doctor that you should be listening to. Dr. Randall Ortel. Good morning.
Yeah, guys.
Not that charlatan from Joburg.
No.
That must shine a bad light on your profession, eh?
Extremely bad. Because now I don't even wear my stethoscope anymore. Because a stethoscope doesn't define a doctor.
It's a red flag at the moment.
It's a red flag.
Because you have to almost like convince people that you are real when you're doing stuff on TikTok. I mean, you started on TikTok during the pandemic, didn't you?
That's correct.
Yeah. I mean, you were obviously, that's not when your career started. You've been a practicing doctor for many years.
Yeah.
And you've got a new job title.
Yeah. Do we say it? I mean, I don't want to post. But,
Come on, congratulations
say it.
are in order.
Yeah, so this boy from Randburg has now ended up being the manager for medical services at Karl Bremer Hospital.
Yes.
Look
Congrats,
at
Well done.
Look
going.
at that.
Yeah.
Well done. So is that like, are you in charge of, in charge of the hospital?
We've got a CEO that's in charge of the hospital. So I'm in charge of all medical services.
Yeah, because the CEO of a hospital is not generally...
It's not clinical. Yeah.
It's not a doctor. It's a business person,
Correct.
right?
Yeah.
Yeah.
So, So, I mean, I am in charge. I mean, I don't like to use that word. So I say we do this thing together. You know, I've got a team. So essentially, I oversee the doctors and all the allied health sciences. And, obviously the support services that supports us in doing our clinical job is obviously where you have a finger in the pie. Yeah. But it's a fantastic experience. It's working with people. Yeah. And that's the ultimate. It's working with people, and we are in the business of people care.
Okay, so where do we even start? All right, I know you were asking Sherlin a few questions about her pregnancy, and you brought up an interesting thing here.
So let me say, it's all the listeners that told me, Sherlin's pregnant, and she's got a twin pregnancy and so forth. And when I looked at her, so Sherlin, can I say the question you asked me? You asked me, are you about to pop?
Yes.
And I said if I didn't know if she had a twin pregnancy, I would say yes, because she looks huge.
Yeah.
So
I know pregnant ladies, the huge is not the word that they like to hear, Doc. Yeah.
But I mean,
carrying well.
They're
Carrying well.
Carrying well. But remember, you didn't allow me to complete the sentence. So that's I need to correct that. So
But she stopped listening after huge, I guarantee.
But so doctor, what was it that gave me away? Is it the size of my belly? Is it my walk or my wobble?
Yeah, look, I mean, your walk looked like you were in the labor ward already.
This doctor's honest, eh?
No, look, I mean, honesty is the best policy. But when I just looked at you, I look at there's something that we call the SF measurement. It's a symphysis fundus measurement. And I was just judging, if I have to put my measuring tape there, you're definitely over 40 centimeters. And
were you putting a measuring tape?
So you start with it off at the, sort of at the pubic bone, pelvis on a female, just above the where the urine comes out. So for those pregnant females that had this examination or this measurement, you would know. So we let you lie back on your on your back, put the first part on your pubic bone, and then measure it over the stomach, because obviously the stomach will be up
over.
Yeah, over the stomach, and we stop sort of in your epigastric area, like where your chest starts, in that area where the fundus is of the uterus, or the top part of the uterus, and we get that measurement. So I mean, we would plot it on graphs. And it usually equates to your gestational age. So your gestational age is like how far you are. Kijk, in Afrikaans voor dat means hoe ver is jy. So how far you are, 35 weeks, 36 weeks, and so forth. So if I measure you and you got a singleton pregnancy, I mean, the centimeters would sort of fit in. If there's any measurement over and above, you say, but I mean, I'm only 25 weeks pregnant, but your SF measurement is 30. Then warning bells must go off. Is it a multiple pregnancy? Is this baby bigger than usual? Is there more, fluid around the baby, etc.? So it sparks you to go and look. So if you look at this, all the screening measurements actually plays a role.
Yeah.
And I was actually thinking when I was driving here, I mean, pregnancy care and what we call ANC. I'm not promoting any political party. It's called antenatal care.
Yeah.
So we just use abbreviations ANC. It's very important. And people sometimes think, why must I go sit at the hospital? Right. But those small measurements that we do, it actually plays a role. And you don't just need the big ultrasound straight off.
Yeah, because I mean, that's one of the hardest things, isn't it? Or maybe it isn't. When you're trying to work out, like you go, okay, it's 9 month gestation period. So is there wiggle room of 2 to 3 weeks either side when you try and work out? But I mean, because we go to the gynae and he says, yeah, you due on this date after the first consult.
Yeah.
And I go, oh, doc,
Well,
because you got to walk it back. And I walked it back in my mind, and I was like, no, doc, you know what? I actually think that night, that was the one. I could feel that's when it took. You know what I'm saying? So you're out by a week, doc.
Yeah,
like,
but-
Sherlin, could you feel like when it took? Like, you got, that's the one. That's the, there's like a sixth sense.
Yeah. So
And it
look,
was Belito, I remember. In the holiday house. I was like, that's it. I knew immediately.
so Darren, just to come back to your question, so there is something that we call the expected date of delivery.
Yes.
So there are ways of working it out. We look at your last menstrual period. I mean, if you come early, we work out the first day of your last menstrual period. So there's some calculations we do there. And then obviously we can back it up with an ultrasound.
Yeah.
So an early ultrasound, that's what we call it's before 20 weeks of gestation or pregnancy. We can sort of work it out. So the purpose of the early ultrasound is obviously to get the gestational age, make sure there's no anomalies, etc., like Down syndrome and those type of things. And then obviously multiple pregnancies. I mean, I'm using the word multiple because people have triplets as well. It's not just twins. So the sooner you diagnose these things or what's happening, the sooner you can care for it, because they're going to come out eventually. They're going to come out.
And some come out like 10 months, 11 months. Why don't those babies want to come out?
What TV are you
Yeah,
watching?
I just wanted to say now, I mean, maybe the months that she uses shorter. There's fewer days.
Or maybe the weeks, but essentially just longer than 9 months,
Yes,
right?
okay.
The baby's baking in there.
Okay, so let's correct this quickly. So we don't like to use months when we work on gestation. We like to work on weeks.
Yeah.
So a week has 7 days. So 7 days gives you 1 week. So sometimes we would say you 20 plus 5. That means you 20 completed weeks and you're on day 5 now. When you get to 20 plus 7, it converts to 21 weeks.
Got
It's
you.
better for us to work it out that way.
Accurate.
So yes, you do get pregnancies that goes post dates, but we usually don't allow them to go after 41 plus 3. Okay, because I mean that's the time you got decreased blood supply, the fluid around the baby goes down and so forth, and your risk of delivering a stillbirth or stillborn is much higher. So yeah, I mean there are some kids that are just lazy to come out. We can think of where conception took place. Maybe it was in slow motion. But, I mean there's various jokes we can sort of speak around. But yeah. So I mean we do get the variations. And just to answer Darren's question, yes, I mean there is sometimes discrepancy between a week or two.
Sure.
But at the end of the day, it's a natural process.
Dr. Randall Ortel, our resident physician. Physician and doctor, are those titles interchangeable? Can a physician be a doctor, but a doctor is not necessarily a physician?
If I think about it on the spot, yeah, because you can get a doctor probably in PhD and those type of things.
Yeah.
But if you specify like you are MD in terms of a medical doctor,
Yeah.
I mean some countries just call it a physician.
Okay. So, Doc, what are the things, just in terms of women firstly, as we head into this season? Because, I mean, there are a lot of people that have a little niggle, perhaps, and they go, oh, what's wrong with me? And you might just be a common thing that's going around right now, which, to me, gives you a little bit of reassurance, So, what is the common thing with women right now?
Sure, with women, it's so complicated because you have to first think out what age group you're talking about. You know?
Right,
So,
right. 25 to 50.
Yeah, singleness, man. Not finding a partner.
Get out of here, John.
Your prescription is 3 months of Tinder.
No, look, I mean,
Free on the medical aid.
I mean, that's why I'm wearing black. It's like Black Wednesday in medical terms, you know what I mean? So, I mean, singleness is a huge thing, and that leads to a lot of psychosocial stressors, man. No, look, I mean, that's
Hey,
my
love
opinion.
is a healer. Love is healing, man.
No, definitely it is, man. The stakes are high, you know, if you're in that age group, you know. Maslow's triad, you know, sense of belonging. But no, look, I mean, the common things that I still pick up is still like, you know, your menstrual issues, you know, PCOS, you know, fertility issues. I mean, acne is coming back, you know.
In adult women.
Yeah, I'm starting to see it, but I mean, again, that's related to the PCOS because your skin is a bit more oily, you get acne and so forth. And then we are seeing the non-communicable diseases like the diabetes and the hypertension coming back in the females of that age group. Because I mean, our exercise is out by the window. I mean, we have a sedentary lifestyle. We eating at all these takeouts, etc. I mean, there's not a lot of emphasis on health. Yeah, I mean, like I told you guys on the radio, I mean, I don't hear a lot of health things being advertised. I mean, it's more your corporate stuff being advertised.
Yeah, the medicines.
The medicines and so forth. And I mean, people will just buy it because, I mean, they heard it on radio.
Yeah.
But they don't really interrogate it. I mean, during COVID, I mean, the vaccine was interrogated. What's the side effects? What's going to happen here, etc., etc. Now, people are selling things, products and so forth, but the consumer's not asking, what's the side effects?
Yeah.
And I mean, I constantly say to the guys, using drugs. I mean, drugs is a huge issue now amongst females as well, because it's like quick fixes.
Yeah.
And I'm asking, like, the person that you buy it from, do they offer you insurance?
Yeah.
Because there's a Consumer Protection Act, man.
Yeah.
Or are they exempted?
Yeah, perhaps. Isn't it like a code or something? and with men, what's the common issue with men right now?
So the men definitely mental health, and mental health is really broad. But what I see is a lot of the mental health on the psychiatry spectrum in terms of substance use, alcoholism, using drugs, tik, dagga, patents, heroin, cocaine. There's a new phrase on the Cape Flats going around as neuskos. So nose food, that's your cocaine.
Yeah.
So because you generally tend to sniff it,
Yeah.
Well, we know these guys that try to look cool, they sniff, sunflower, what's this, self-raising flour and stuff. It looks like cocaine, but it's not the real deal.
But they're doing that to look cool.
Yeah, remember, kids emulate what they see.
Sure, yeah.
So if you watch kids play, you can exactly see what's happening.
Yeah.
Okay, so I mean, I see a lot of drug issues now amongst men, and if I look at it, the load that men has to carry and the expectations from society and so forth, not a lot of men is geared to deal with that type of pressure.
Yeah.
Because that pressure is not visible, you feel it.
Because is it true that the highest suicide rate is men in the 45 plus?
You spot on. So there's something, and I'm actually glad you're bringing this up, because we got this men's health awareness talks on Friday at Karl Bremer Hospital. But there's something that we call the sad person score. So if somebody says they are suicidal, I want to know, how suicidal is this person, man? Is it a chance take, or is it the real deal?
Yeah.
So I mean, the age is 45 and above. If you're 19, if you're younger than 19, you're also at high risk.
Really?
Younger than 19, older than 45, that's in terms of age. If you have lack of social support, you've got any other comorbid illnesses, diabetes, etc. And let's say what are the other things now? Alcoholism and so forth. But I mean, the bottom line is we use a sad person score, and we actually work out your risk of actually wanting to pull through. Like, some people already have a plan. I mean,
and is that just a questionnaire, or is it blood tests? Or
No. That's a questionnaire.
Yeah.
So remember, I always say this: as a doctor, you must be a detective first.
Yes.
Because the history taking when you talk to a patient is so important.
Yeah.
There's a lot of things that you pick up by talking and making eye contact and looking at body language and so forth.
So I mean, every guy now that's over 45 will tell you, "No, I'm fine.
Yeah.
I'm fine. What are you talking about? I'm fine."
Yeah, but the way he says he's fine. So I mean, I'm looking at your frown also now. It's a bit too aggressive, Darren.
I'm acting.
That's what I'm saying. Okay, cool.
They say that too.
Yeah,
okay,
they
Doc,
do.
ask me again.
No. But now you know.
But so, doctor, what advice do you have for men and women who say, you know what, I'm not coping.
Yeah.
I might be suicidal.
So the thing is this: you got to talk. But again, that's dependent on the person and how they were probably raised and their values and so on, and with who they talk to.
And the openness.
And the openness, and if they have that person to talk to. Because nowadays you also talk to people, and the next day your story's in the tabloids, or it's on the streets. So, people are also cautious of that thing. If you can find somebody reliable, to talk to, you can. I mean, if you have the means, you can obviously see a psychologist. We're not saying a psychiatrist. We're saying a psychologist first, or seeing people that specialize in men's health and so forth, but or mental health.
And Doc, what do you say to those people that would say to you, well, look, talking to somebody is not going to change anything.
Yeah.
The situation needs to change.
Yeah.
You can't just tell me, you know what, it's all going to be okay.
But I tend to like those patients because it's problem solving. So the more fact that they can talk about it, it means it's been registered.
Yeah.
They can articulate it. they are thinking about it. Remember, you need to think when you talk.
Yeah.
So you are also thinking that is part of therapy already, is just getting that process out. Then you are speaking to the therapist. Remember, you've got a half an idea. The therapist might complete that idea for you.
Yeah.
There's so many times I see things and I'm like to patients, but look, if I make a drawing, this and this doesn't fit. Maybe overspending here. I'm just making an example. And they're like, I never thought of that. And it's something simple for me. Then I thought like, okay, couldn't this person see it?
Because I'll give you a first-hand example with somebody that that I took to. I felt that they were a bit
Off the rails.
not off the rails, just struggling and not going through it, not battling to handle the surroundings and the situation. So I said, listen, I'm going to take you to the doctor. And this person was so defiant, like, no, well, I don't need, what are you talking about? Sat there with the doctor. I said, Doc, listen, over to you, but do your work. And this person was like, I'm fine, I'm absolutely fine. What are you talking about? I said, Doc, please ask your questions. And then this person's like, no, I don't need anything. Just a little happy something to help you get along. And they're like, no, I don't need anything. And the doctor said, and this was like a penny drop moment, the doctor said, listen, if you were in a forest, in the Amazon jungle, and they said, stuck in the middle, get out of it. You're going to walk till you're dead. You're not going to find your way out. But if somebody handed you a compass, why wouldn't you take it? And that was the penny drop moment where the person said, give me the compass.
Yeah.
Taking your questions now. Okay, Doc, the 1 minute consult. People firing them through on the WhatsApp telephone. We're not going to get to all of them, I'm afraid. This is a lot. But we'll try to pick the ones that most people have. Okay, so here's your first question.
Darren, I hope you guys are going to hear this one. So I suffer from migraines. I was in hospital 2-3 years ago. MRI scans, CAT scans, CT scans, brainwave tests, and all they found was a blockage. So I had to use blood thinners. But now for the last 2 weeks, I've been struggling again with these headaches. It's terrible. You go sleep with it, you wake up with it. The doctors don't know what to do anymore. So is there any old school remedies or something that I can do, because the doctor gave a note obviously for work, for me to work in a dark room, try to stay out of sunlight, stuff like that.
You can hear the pain that man is in.
He is suffering.
That's debilitating.
Yeah. I just want to correct, man. We, as the doctors, we always know what we're doing. I always hear that statement, doctors don't know what's happening. This man's got a blockage. He just said he had a blockage. So if he would be my patient, I would obviously explore and see what caused the blockage. I mean, what if he's got a disease that predisposes him to clots? I mean, if you have one clot and it's gone, doesn't mean it can't come back again.
Sure. Yeah.
So, I mean, if his symptoms are coming back again, I mean, then he needs to be investigated again. But, patients are like, don't smoke this, man. I don't list for this lust again. That's normally what patients say, because they don't want to go through the same process again. But if you have a disease that predisposes you to make clots all the time, I mean, the clots can come back.
Sure.
So, I mean, if he's having headaches again, and I mean, a headache is something that's obviously serious. I mean, we're speaking about your central unit here. So, and I mean, if he has a clot at the wrong place, he can also stroke.
Yeah.
So, I mean, if you have a stroke and now you're disabled, I mean, that's another thing. So, I mean, I would obviously go back and have it reassessed again.
Okay. Do that, sir. Please.
Yeah.
Please. And today. Not tomorrow. Today. Next question.
Why, especially in this generation, why so many young females are trying to conceive and struggling with fertility?
Yeah, very common question. The bottom line is, the lifestyle. I mean, the young females are smoking, they're using alcohol. Okay, I'm not saying everybody, let me not generalize, right? But not a lot of them are having fitness, wellness, those type of things, because it takes a lot to be healthy and fit. It takes a lot. I mean, you can't just go by the normal run of the mill. Then the other thing is this, if I take it back, monitoring and speaking about these things up front, monitoring your menstrual cycles, having menstrual calendars, you can pick up these issues quite early. Because, I mean, some girls have their periods as young as 13, 14. So, I mean, if your parents start to see, menstrual irregularities, don't ignore it. I mean, there could be things that's repairable. I mean, you could be having low thyroid functions and those type of things. Now, people only discover it now that they want to conceive. And then you have to repair what could have been prevented. But anyway, let's come to what's happening now. So, that's the problem that we are seeing. So, I mean, we need drastic, new life changes. I mean, a lot of these females, have central obesity. I don't want to use the word FAT, and it's around the stomach area. And it does affect your chances of fertility. And then on the other side is we can't exclude the males, right? Because, I mean, you need sperm to fall pregnant.
Sure, yeah.
So, I mean, fertility is 40% female, 40% male, 20% is in the middle. It's both of you. And I want to speak to my brothers here, man, to the men. And say, look, guys, go for the sperm test, man. Even if you don't want your lady to know, I mean, do it then in private and see if you're fertile or not. Because otherwise, you're coming to the match, but score doesn't matter.
Yeah, not
because,
everybody.
you're just firing blanks here.
Yeah,
and then you're getting somebody's hopes up. You understand?
Not every guy's got Chad Leclerc.
Yeah.
There,
I'm
That's
so
okay.
happy you spoke to the brothers too.
No,
and
I have to.
destigmatize the having that test, you
Yeah.
know,
And-
because people feel shame, getting that checked.
No, you know what it is. It's the worst thing is what you actually have to do, where you have to go to this clinical room
get
and they
checked.
throw you a magazine and say, hey, back in 5 minutes, please.
Yeah.
That's pressure, you know what I'm
Yeah,
saying?
but I mean, nothing stops you from taking your partner along.
Yeah. It's still like everybody's walking in there knowing what you're about to do.
But I mean, that's the thing. You got to think of the prize, man.
Yeah.
Keep your eye on the prize,
You're
you know.
trying to
It's like-
build your family and
it's like-
grow your family.
Can't I bring a sample from home?
You can. So here's the thing is, you can pass a sample at home, but you need to get there within 20 minutes.
with 20 minutes.
Wow.
And then
Okay.
it needs to be kept in the right temperature. You understand?
A cooler box. The cooler box that carries the meat to my mate's bringing bra. Why not?
Look, don't give the guys ideas because now cooler box will be out of fashion for the festive season.
Can do it in an old in a beer bottle. You know what I'm saying?
No. Look, we normally want like a see-through cup, etc., etc. But I'll post a few things on my TikTok, and then people can see how we do it. But I mean, what we look at on the sperm is literally the volume, and we look at the sperms. I mean, is the heads okay? Is the tails okay? Can they swim up there? Does it look okay? But I mean, the guys are obviously smoking, using alcohol. I mean, doing sports and stuff that these constant clashes against the testes,
the cycling.
and then all the things that we like that we are doing, man. It's not good for sperm. So guys that are on the treatment, when we put them on zinc and those type of things, they realize and okay, let me stop this. And then I ask these guys to come out and just say, look, this is why I've got a sperm issue. Just come out and tell the brothers. But now you see, the thing is this, we are not.
You're not a real man if you have sperm issues and that stigma is holding people back.
But it goes deep, man. Because I mean, even if you go for IVF and those type of things, I mean, it's a psychological thing because it's not your DNA. There's so that is why I'm saying mental health at the moment for men. It's multifactorial, and these are the type of things that we deal with because these things are showing up now.
Yeah.
Because we are a little bit more clearer. So on the fertility question to this lady, it takes two people to tango.
Yeah.
And then just the bottom line is try to get into fitness, try and get that menstrual period going. And people normally ask me, but now why does the doctor put me on family planning if I want to conceive? But remember, in the tablet is hormones. Yeah. So we are trying to emulate your cycle and to try and kickstart it again.
Right.
So you must please listen to us and use it for the 3 to 6 months so that we can at least just see where we are in terms of your cycle.
It's like a defibrillator.
Correct. We're trying to reset.
Yeah.
Because you can't get pregnant if you don't have an egg.
Yeah, sure.
So you need to help us along here.
Okay, Doc, here's another question.
Morning, doctor. Just a quick one. Will willy, man's willy, last forever? Or be strong forever? Or is there time in his lifetime where willy will just go to the cupboard or just to put willy away?
The amount of times that grown man said Willie.
Yeah. So I was just thinking now, were they speaking about Willie the whale or something?
I wasn't sure what he was talking about
Yeah.
at first.
But anyway, that again speaks to the fact, Darren and guys, that how patients come with their lingo to the hospital. And if you don't pick up what they are saying because they are shy, you're going to misdiagnose.
Yeah.
So this guy will be very disappointed if I give him a packet of Panados and say, Willie will come right. You understand? Because I'm thinking he's talking about his nose.
Yeah.
But now I believe he's talking about something else. Look, guy, it's a family show. Can I use the, no, let me not use the word. But I mean, the more you train a muscle, the stronger it becomes.
Right, yeah.
Okay, so But on the other side is, I mean, the penis only has a very minute blood supply in terms of like 4 arteries.
And usually it's a sign of heart disease, isn't it?
So look, not necessarily heart disease. We call it cardiovascular disease because it's your blood vessels to that area that is affected by either diabetes, hypertension, overweight, smoking, alcohol, all sorts of chemicals. I mean, people are exposed to weird and wonderful things nowadays. Okay, so I mean that has an impact on the blood supply into the penis to get an erection and obviously to maintain it.
Yeah.
But then on the other side again, there's other psychological factors in terms of anxiety, performance, do I have premature ejaculation, those type of things. And maybe, that person they also a blank. So your brain is so fantastic. I mean, if you know you're going to waste your time, that thing won't even show his head. So just to come to the bottom of his question is, if you read about erectile dysfunction, I mean, there is a decline as you go down in age.
Yeah.
But if you prevent all the risk factors, I mean, you can maintain it.
Yeah, makes sense.
You can maintain it.
All right. Doc, Randall Ortel, thank you very much for your time this morning, sir.
Thank you.
Always a pleasure.
Thank you so much. Thank you so much, guys, for making me famous. My phone is off the hook. And as you can see, my focus is men's health.
Yes.
So if I do open a private clinic sometime, I'll probably be focusing on men.
Good.
Okay.
Yes.
Because they will bring the ladies along.
And their wives will take them to your practice because it takes a long time to get a man to go to the doctor.
And the beauty of that is I can charge a double consultation fee. Because it's the wife bringing the guy. So I must first listen to her and then to him. So it's a 2-in-1.